Welcome to the Morning Phillips series, hosted today on YouTube. The Morning Phillips series, originally hosted at the Garage co-working space in Rapid City, South Dakota, was created to discuss philanthropy, civil society, and community. It is an opportunity to have a conversation with good people doing good things creatively and collaboratively. The format is a conversation, not a presentation. 2 tables, 2 chairs, 2 computers, and a community of interested people watching on their computers. Today, we are pleased to have with us an internationally recognized ethicist, clinician, and teacher. A special thanks to the Bush Foundation, the NewMad Group, Rural Philanthropy Institute, and the Garage for hosting today's conversation. Thanks to all of those who have joined us for over 65 previous conversations. Now, with all that, we are pleased to welcome Mark Kuczewski, the director of the Neiswanger Institute for Bioethics and Health Policy, the father of Michael I. English S.J. Professor of Medical Ethics at Loyola University Chicago Stritch School of Medicine. Mark, thanks so much for spending this morning with us. And this is the second time you've joined us on Morning Philip, just 2 years ago. Really appreciate your time this morning.
Well, thanks for having me back again, so to speak, Matt. It was December 2019 when I last visited you in person, and I really loved my visit to Rapid City, and the people I met there. It was just wonderful, and it's good to be back even in this way. But it was so wonderful to be with you all physically back then.
Well, it'll be nice to be in person when it's safe and feasible, but really appreciate this virtual opportunity. And a lot has happened since December 2019. And if we just jump in right now, I guess I want to just throw out the question of, when you think of 2020, where do you start when you think of that year?
It's that's such a big question. I think we're now, as we're starting to see the light at the end of the tunnel, starting to take a little bit of stock of what happened, and trying to process this a bit. And it's going to actually be the 1-year anniversary tomorrow of a press conference that President Trump gave, where he talked about what we could expect. And he said, we were in for some tough times, and that we could expect to lose 100,000 to up to 240,000 Americans during the pandemic. And everybody was shocked at the time. We thought, he's trying to lower the bar for expectations for their success in the fight against COVID, because we thought those numbers were just staggering. And now, as we look at this, we've become numb to the numbers. As of yesterday, we went over the 550,000 death mark. More than 500,000 people have died, and died in ways we didn't really expect us to ever have to die in the U.S. again, alone in an ICU. And it's just, it's staggeringly hard to process in many ways.
Mark, what changed for you a year ago? How did this change your life as an ethicist in a hospital?
Right. Well, the first thing that happened in hospitals was everybody who didn't absolutely have to be there got sent home, because the medical students were moved out of the hospital. Personnel like social workers and people were sent to work from home. Ethicists who would go to the bedside typically to help negotiate when there were conflicts or disagreements about treatment plans. Often at the end of life, we used to go and convene family conferences with physicians. We were all sent home because you couldn't have any more people coming in and out of the hospital than you absolutely had to, for fear that people were carrying the virus. And so the hospital became a place that was very different, where places were converted into ICUs overnight. Negative air pressure was put into so many rooms to try to slow the spread of the virus. And all those people who had the capability of working in ICUs worked around the clock. And as an ethicist, much of our field came out of the late 1970s through the 1990s, where we were trying to change the way people died to a more humane and compassionate environment, so that where people got choices, whether when death was inevitable, they wanted to continue on ventilators and all sorts of high-tech interventions. Whether they wanted us to dial that back and have the physicians keep them comfortable so they could spend more time with their families, interacting, have more quality time at the end, say their goodbyes. And so that was the vision we've been working on for 30, 40 years in this country of changing death. And suddenly, death was again an ICU locked down with healthcare professionals gowned, gloved, masked, face shields on, holding up cell phones to the ears of dying patients so that they could say goodbye to their loved ones and family members. And it's devastating to me as an ethicist to have been put into this position and seen our vision kind of shoved back to the back burner by this emergency. For the healthcare providers, obviously, it was incredibly tragic, as they just were working round the clock to try to care for these patients, well over capacity. And our hospitals have seen these surges. Their surges recede a little bit. We let take our foot off the pedal. The surges come back, and that's one of the hardest things for me to grasp, is that as a nation, we didn't summon our will. I always thought of America as can-do place. We're the best. If we needed to mobilize to do something like crush a virus and get ourselves back to normal, we would do that. Instead, we're on the 5-yard line now with the vaccines here, and that hope, has returned. We're just around the corner. And we've again taken our foot off the pedal, and we're seeing our hospitals surge again. And this is almost incomprehensible to me. It's a bad dream. It's a nightmare. It's not who I thought we were.
Mark, I want to talk more about that and hear more about who we think we are as a country and what the evidence shows how we act in the crisis. Before we go there, and obviously speak about the director of the CDC yesterday talking specifically about what you're saying, that the surges and what I think her quote, an impending doom. But we'll get there. Mark, you're one of the most well-known medical ethicists in the world. You research, teach, and practice at Loyola University in Chicago, a Catholic Jesuit institution. Why there? You could be anywhere.
Loyola is a wonderful, wonderful institution. As you mentioned, it's a Catholic university sponsored by the Jesuit priests, the Society of Jesus, as they're called. And the Jesuits are known for various mottos, including care for the whole person, cura personalis, and so that we're not just about teaching facts or informing people with certain habits and ways of thinking. And our another Jesuit motto, men and women for others. That it's wonderful to get education. It's wonderful to be successful in our careers. But in the end, we have to think about how are we serving others? How are we serving others who are not as fortunate and are a little bit left out of that opportunity? Catholics are Christians. We're in Holy Week right now. And the image of Jesus is of a person whose closest friends and followers were the marginalized, the outcasts, the people who were left out, who he looked at and he saw something in them. And he said, follow me, and then serve others. And that's the tradition, the educational tradition that I find really special. And it was these Catholic universities were often founded 100 years ago or so, back with the last big wave of immigration to the U.S. coming from Europe. And people considered outcasts, and the signs were up at other institutions like no Irish need apply. And these were founded as their universities, their hospitals, the places that said, welcome, you're welcome here. And so when I was with you last time, we talked a little bit about immigration, because we're kind of recommitted to that mission again, because we have a new wave of people who who are being marginalized, who are being vilified in many corners. And so to be at a place that really is committed to this gospel vision is very special to me.
Do you think that what's the role of the Catholic Church and institutions like Loyola, but the Catholic Church as a whole, when we look at this past year, when we look at COVID, and we look at the idea of a society post-COVID, or managing COVID more successfully?
Mm-hmm. Yeah, well, the traditional Judeo-Christian way of thinking is that when the question is asked, "Am I my brother's keeper?" the answer to that is yes. It's not that I impose my will on my neighbor, my brother, my sister, but insofar as I not only have a duty to help people when they're marginalized or forsaken, but I also have a duty, a responsibility to them to not spread things to them, to not if I can prevent somebody else from getting sick by my behavior, I should prevent that. It's freedom is important. We want our freedoms. We want the right to make our choices. I want people to be able to make choices at the end of life as to what kind of treatment they want. I want to be able to practice my religion. I want other people to practice their religion. These freedoms are foundational to America, no doubt. But it's a very immature sense of freedom, almost an adolescent sense of freedom that says, you can't tell me what to do, even if I'm going to make you sick. I mean, that's childishness, right? If I, the amazing thing about this virus, and the thing that got us in a way that the other viruses like SARS and MERS did not get us in previous decades, was this one, we spread it without knowing we have it. We've often heard people talk about asymptomatic or pre-symptomatic transmission. And so we have to do things not because we're afraid of getting it, but because we need to fear giving it to somebody else. And so I don't know how we can think of ourselves as Christians or Catholics and say, don't tell me to wear a mask, or don't tell me I can't go eat indoors somewhere for a while. Look, you should be able to tell me if you don't do that, you're not really being Christian, right? That's the message I think the Catholic Church is trying to carry in this. And now everybody's struggling. Everybody's trying to say, look, there are other things we have to balance in this. No doubt, right? Children, especially small ones, being away from their peers is hard. Not being able to be in worship spaces together is hard. But, if we really had pulled together and been determined to crush this thing like some other countries were. We look at the examples of China, South Korea, Australia, New Zealand. They really aren't reporting cases anymore. If we had really said it's our national mission, it's our mission as a Judeo-Christian nation to pull together and eliminate this thing, we could have. I heard Dr. Birx say the other day that maybe the first 100,000 people we can't really blame ourselves for, that we didn't know enough about the asymptomatic transmission. We needed to see that this was serious before we really could rally that way, but all the rest didn't have to be. And the Catholic Church, I think, as well as every religious tradition, has the same thing, that we are all children of God, and we're responsible for how we treat each other and care for each other. And I really think that somehow we didn't carry that out the way we should have.
Mark, I want to ask you, why don't you think we did it? Why don't you think we carried it out, especially when we're so confident in we seem to be so confident in those beliefs or this idea of America, but yet if it's really about what we do and how we live, that is representative of who we are. I mean, if this is a grade, if you graded the country, what grade would you give the country? And more, why is it so difficult for us to live up to those beliefs that people so much hold on to, whether religious or the idea of America?
Yeah, it's a great question, and there's probably not one single answer. If I were to give us a grade, though, the best we could do would be about a C minus. It might be a little lower than that even. The Because we did do some things. I mean, we did go home a year ago for several weeks, and as a nation tried to do this. But again, we seem to have always let up, not maintained the will to do that. I mean, really, if we were going to crush this the way those other countries I mentioned have done it, we would have stayed in the stay at home till the case numbers came down so low that we could effectively track them and trace them, so that we could know who had contacted whom, and every time a case was reported or confirmed, we could trace it and sort of quarantine those folks and keep this from spreading the way it has spread. We didn't do that. We took our foot off the pedal, and so we have gotten used to thinking of about 30,000 confirmed new cases a day as good. And the highs have been in recent months, we're up over 200,000 cases a day. There's just no way you can track and trace that. Even with an army of tracers, you're just letting the thing spread at that point. You're accepting it and waiting on the vaccine. I think there's a number of things. We are not unified as a country. If you think about just national pride, nationalism, right? If we said, this came to us from a foreign shore, and we really are angry about that, and maybe it was covered up a little bit more and it shouldn't have gotten to spread here like that. The right response to that is not to turn on Asian Americans. It is not to give denigrating names to it, like the China virus. The right response to this is to say, we're Americans and you can't get us that easily. We're going to crush this thing. And we all pull together and do it. A nationalistic effort to unified to do that. And that shows your strength as a country. And we've kind of lost that. Instead, we kind of turn on each other. And I think much to the delight of countries that consider themselves our rivals in the world, now, and I don't use the word enemy, but rivals. I mean, we are economic rivals with China, right? And that they've pulled together and crushed the virus. I'm sure they feel a certain nationalistic superiority to us in the sense that we have not been able to. We keep blaming each other. We keep saying you're doing it wrong, and taking our foot off the pedal. And so the fact that we are more likely to turn on each other than marshal our collective strength to go after a common threat, such as a virus, is part of it. And I don't know how we got into that, and I don't know how we quite get out of that. But I think that's at the root of it, is this real lack of commonality or feeling of camaraderie. Now in the vaccination, perhaps we're regaining a little bit of that. We do have a mass mobilization going on, and it's the greatest mobilization of my lifetime. There's no doubt about that, and I'm a pretty old guy, and so that maybe some national pride in that, and hopefully that will persist, and there will be the pride that it becomes a thing to go get your vaccine, that it's something that helps other people. We have to remember we're going to have vulnerable people among us for a while because we don't yet have the vaccines approved for children. And while this doesn't spread quite like the wildfire among them, it does among us, there are children who've died from this. There are children who are getting very seriously ill from it. And in fact, the rates are rising suddenly. And to protect our children, maybe we can summon that sense of national purpose to all go get our vaccination to help the kids. I don't know.
And I appreciate what you're saying about national pride and coming together. It also seems like we as individuals have decided to stop thinking, to hand off the responsibility to a leader or to somebody, instead of drilling down into whether it's a religious belief or a belief of, I mean, if you walk this out a little bit, even if it's about freedom, how free are people right now to travel to Canada, to other countries, or free to do things? So the longer people don't take responsibility and act responsibly, the longer it's going to take to manage this and have some normalcy. So I think the individual responsibility, and I'd love to hear your thoughts on that, more on that. And to your point of new COVID cases, I think yesterday there were 60,000 new COVID cases. And like you said, 1,000, nearing 1,000 deaths. And the director of the CDC saying, just hold on a little longer and get vaccinated. She repeatedly said yesterday in news conferences. Mark, you're a medical ethicist, so when we first met, I had to understand a little bit more about what a medical ethicist does. Will you talk a little bit about what you do? You mentioned being in the hospital, you mentioned end-of-life care. Will you talk a little bit about that and how that's changed? We'll get to more because of COVID, but medical ethicists, what would you be asked to support in the hospital?
Right. Well, the ethicists are asked things that are both at the bedside decision level and at the policy level for the institution. And so questions about, at the bedside, talking with families and physicians about end-of-life treatment and whether what we're doing makes sense for the patient or and reflects the patient's wishes and values, or whether we're doing things sometimes that are really based on our values, is often the kinds of things that were brought in, and helping to process those decisions, and often at the beginning of life through the end of life, because in many ways, people like myself were recruited into this field 30 or 40 years ago because we're lay people, we're not physicians, and we didn't bring the medical perspective. We understood the layperson's perspective, and too many of the decisions in the hospital were being made strictly from the medical perspective. And so we're kind of an in-between animal that understands both. And so, we also help to develop hospital policies and thinking about things related to the outreach to the community, to things like, we were recruited to help create triage policies for ventilators at the beginning of this pandemic. If I think about what I was doing a year ago today, I'm probably pretty sure that I would find files on my computer that dealt with ventilator triage, that if the hospital got overrun with too many patients, and so there were not enough ventilators for the people who needed them, how would we give them out? Who would get one? And so we started creating policies like that. And one of the interesting things about that is we do these things in theory sometimes at the beginning, and then we learn some things about how things actually play out and about what's really possible in a clinical setting. And we get some surprises along the way.
Do you want to talk a little bit about some of those surprises?
Sure. The big one, I think, is that nobody in the country, despite the fact that the bioethics community really rallied together and made sure that all our hospitals had vent triage policies that looked something like each other's, so that nobody was doing something very different from each other. Nobody in the country has implemented one. And that's a pretty amazing fact. Now, let me
more about that.
Yeah. I'll tell you plenty. In one way, there was less. There were fewer instances where one might have needed them than we thought. Even though the numbers were huge coming in, the doctors discovered at the end of the surge in New York, pretty much, which was the first big surge in the country, that you shouldn't be ventilating these patients as early as they thought they should be ventilating them. And so based on their oxygen saturation, how much oxygen is in your blood, typically the numbers were really low on COVID patients, so low that on a lot of patients they would have thought they'd be dead, but they certainly would have intubated them with most other respiratory illnesses, but found out these patients did better if you held off longer. And so they did something called proning them. They essentially put them on their stomachs and discovered this was more helpful. And you waited till very late in the game to ventilate them, and the patients did better. So it eased the demand for ventilators. So that helped a little bit. But even in places where it was clear there were not enough to go around, nobody implemented the policy. They found that they might be able to use the framework. If two patients came in at the same time, the ambulances showed up at the same time, and there's one ventilator, they might be able to say, okay, based on these scores that we have of how they were likely to do, this first patient is way more likely to survive than the second one. Let's put the ventilator on the first patient. But nobody ever said, went into the ICUs and said, this patient is really unlikely to survive and we don't have enough ventilators. So let's give it to this new person who arrived because they're more likely to survive. And the policies were designed to do that. If we were rather sure we'd end up with two patients dying unless we moved the ventilator from one to the other and saved one of them, we wouldn't do that. But we should do it if we're going to save one of the two and not end up with two. But it turns out, and it depends who you talk to. Some people will say this is a legal thing, that they were afraid they didn't have appropriate immunity, that state laws didn't give them sufficient immunity from prosecution or anything like that if they were to do it. But I think many of us come down on the side that it just isn't something you can ask a doctor to do. It turned out to not be that. However strongly we might feel, in terms of, look, it just makes sense, save one. It's a lifeboat situation. The lifeboat's going down. If you can save one, save them. That in reality, you can't ask healers to do it. They're going to take their chances. They're going to do everything they can for both patients and hope that their predictions were wrong and that you save one or both anyway.
What does that say about the history, and to your earlier point of end-of-life care and how the medical healthcare system has evolved? And you've written lots about this and spoken about this, using more quantitative and more calculated versus measurements of what success is in decision-making process versus looking at the whole person and the care of the whole being there, physical and soul. What does that say about if at the point of crisis, at the time that we've built this supposedly the best healthcare system, one of the best in the world, that we don't actually follow through?
And it's not an easy question. Because I kind of waver between whether what we've just discovered here was a good thing or a bad thing. The bad thing is sort of, as you're saying, we'd really like to have as few deaths as possible in a situation like this. And in the old days, back before there was bioethicists, the physicians fought for life for each and every patient, tooth and nail, and didn't want to dial it back, even if it was pretty clear that they were not gaining benefit any longer from that fight. And we've evolved to a point where physicians now do work with patients and understand that just extending life by hours to days to weeks isn't always the best thing. That what a physician offers is comfort and compassion sometimes, and allowing the patient to have the best quality of life and a good death in some sense, a death with in the bosom of their community and with their family, sometimes even at home. But that, when it comes to this moment of crisis that we've been talking about, where you might have to take a ventilator off one patient and give it to another, against their will. The patient isn't saying, take my ventilator. The family isn't saying that. Every family wants their patient to have every chance as they could, because of course these people weren't terribly sick before they got COVID. It wasn't like they knew they had a terminal diagnosis, and so they want to fight. And there's a very good sense in which maybe it's really good that our healthcare system, our healthcare professionals, our physicians want to work closely with patients and do things according to their wishes, and that it's alien to them now to impose something against the patient's wishes, such as removing that ventilator. Maybe that's a good thing. And so it's it's hard to say it's hard to say how we should be looking at this.
Do you think the definition of community and society will change because of COVID? What do you think the impact of COVID in 2020 and 2021 will be when we look back?
Yeah, and my crystal ball is cloudy, but I have hopes. And a couple of those hopes are that maybe we can come to a realization that we are all in this together, that we really to think of ourselves as strictly individuals, and not affected by other people, and not affecting other people. It's just a little bit of a myth. A virus should convince you of that we are all tied together. The thought of who's worthy of treatment, who's worthy of something like a vaccination, are preposterous questions. If we don't get everybody vaccinated, we don't get herd immunity. Everybody's less safe if we're not all safe. And I think that this pretty much illustrates that. When I was talking about the concern of Jesuit education for the marginalized in society, we've renamed a lot of the people who we consider marginalized with this wonderful term, essential workers.
Mm-hmm.
It says something that we realize that the labor that has kept us going at times during lockdowns and when we have to distance were people who we wouldn't have thought of, people who go into the grocery stores every day, and people who perform all these tasks that are that we need just so that we can continue our sustenance, even if we're trying to stay distanced from each other. And of course, with that, it's a wonderful term. I hope it reflects what we consider our obligations to them in the future, though. That most states have prioritized them to some degree for vaccination, realizing they're the key to their key infrastructure as in our society. But hopefully we will understand that they need to be making livable wages, and they need to be able to go home when they're sick. It's really not good to have people who don't have paid sick days, right? That you have a low-wage worker who, when they're sick, is motivated to come to work rather than stay home. That makes us all less safe, and yet we've never really thought about that much. I think most of us haven't thought much about that, and so I'm hoping we can see our common fate together a little bit more going forward.
Historically, we've internally talked a lot about this, that people seem to be we run away from being uncomfortable. We block off memories of bad things. we tend to forget, and this came up yesterday even, just that what are the chances of we try to bury this year and forget this year? I mean, how do societies not do that? How do people not do that so that we, like, that was, let's shut the door on that and move on and go back to normal life. I think that's a concern that some of us have, is that this is uncomfortable. This is a bad, bad dream. How do we close that off and get back to normal and back to the things that I am comfortable with? Because that would be a huge miss. I wonder what you think about that.
Yeah, again, I'm hopeful. I'm hopeful on this score. Because we do have examples in our history where things were pretty difficult to live through, yet people recall them with great pride and with almost as a morality tale that they tell. I'm on the tail end of the boomer generation, and which means I grew up with a father who fought in World War II. He was a Marine who fought in the Pacific Theater. And as horrible as much of his early life was, growing up in the Depression before going off to the war and fighting in the war, that generation told us a lot of stories. They told us the stories of people pulling together during the Depression, the Great Depression in the United States, to make sure each other had enough to eat, to try to help each other get by. Things they had to do to sacrifice for their families in order to keep them afloat. And then making great sacrifices to go off and keep the world safe for democracy, essentially. And they told these stories, and there's always ambivalence in what they told us. I mean, a lot of times they didn't want to talk about particular details of the war and things like that for obvious reasons. But trauma is when every time you remember something, you relive it. That's unpleasant. But we don't have to relive it to remember it. We can continue to remember these things and tell the stories of the positive things. I know our medical students, had a difficult time initially because we got to pull them out of the hospital, and they're doers. They want to do something, and saying go home and sit down and read a book and listen to a lecture on Zoom didn't sound too exciting to them. And they found ways to contribute. Sometimes in menial tasks for the people who were working around the clock in the ICUs, eventually supporting some of the healthcare professionals who started up mobile testing sites in the underserved areas of our communities. And these stories of heroism and of people, and the everyday heroes, the teachers trying to struggle to teach remotely and help each other. And we don't have to be Pollyanna. We can tell the stories and try to say there were threads here that were good. There were negative things. We want to get it better next time. But there's a lot of things that we did correctly. Whether we're getting, say, things like the vaccine distribution right now, it's still true that some underserved groups are not getting it at the same rate as others. There's a real national effort to try to make sure everybody has access, that nobody gets left behind. The president yesterday started talking about by the middle of April, nobody should be living more than 5 miles from a place they can get a vaccine. We've sent it to the federally qualified health clinics in the underserved areas. We've sent them to the pharmacies in the underserved areas. We've tried to help her, and now we're not getting it perfect. I wrote a blog recently about how pecking at your computer, hitting the refresh button for hours at odd hours of the day to try to get an appointment is demoralizing. But nevertheless, we're really trying. We're really trying to do what we can here, and we need to tell those stories too. And next time, God forbid, but there will be other national emergencies. Next time, those are the stories we start with. We pulled together and we got it at the end, right? let's start with that way. And I don't see why we can't do that. Because there are plenty of, people are good, Matt. I believe that. We didn't get this wrong because we're evil people. We but we made mistakes, and we went down. We indulged ourselves in. We were self-indulgent to a large extent. We kept thinking that so many things that were important to me were more important than my neighbor. But we don't have to think like that. That's not us.
Do you think we're more susceptible to that thinking today since the BlackBerry and iPhone in the earlier 2000s, and I think 2008-ish or so with the iPhone, we say we're the most connected society, or we're more connected than ever before. But yet, what you just said, we're also more self-indulgent and probably more, and earlier, more disconnected to each other. We get such a whatever from being connected with our devices and social media and whatnot, but yet we scoff at the idea that we're connected enough to wear a mask.
Yeah, and I don't know the role that technology has played in this. It's very easy to see both sides of that, right? That we can talk to each other more easily. We can reach out. We can gain information from each other. We can spread misinformation more easily as well, and we can become self-indulgent. Again, we can cut off our flow of information so that we're only seeing things that already go with our predispositions, rather than things that make us uncomfortable, as you say. And so it is hard to know exactly how to reconnect more closely, and how we do that. And so I don't know, except to listen to each other's stories as much as possible. And technology can mediate that. It can help with that. But we have to be open to listening. One of the things I've been talking about, going back to your earlier question about COVID, is that I think it's good that we're having we might have a period of national mourning where we tell the stories of the people who died, because they died so quickly in such large waves that they just became these numbers. And actually realizing what happened, and processing that, and realizing that we've lost something. Each other has lost something. Hearing that from each other, who was that they lost? I think that might make us a little slower to vilify each other. At least I hope so.
Mark, one of the things I struggle with, and actually I was texting with my mom, talking about and this came up even this morning. United States has one of the most well-funded healthcare systems in the world, and yet we're receiving vaccines. We're at a higher rate, I think, than any other country in the world. I guess I think of ethics, and I think of, like, shouldn't the most vulnerable be given first the vaccines versus the wealthiest with the resources to reduce or to fight this virus? Help me. Can you talk to me a little bit about that? Because that's something that I think about. I know I brought it up too before, but would you share a little bit about that?
Yes. And this is a complex subject, actually. I think that there's a number of ways to look at it. And one is that in the end, none of us are safe till everybody's safe. So in the end, everybody has to have good access to the vaccines in the world. There can't be pockets of the world where there's not good availability, and the virus runs rampant and mutates, and then we get variants that come back that escape or elude our vaccines. And so then it starts spreading here again, even though we're vaccinated. We have to repeat the whole mobilization process with new vaccines. So in the end, there is no doubt that the whole world has to end up vaccinated. And we have a very large role to play in that. We're not the only country that has a role to play in that. The developed world, many countries are already beginning that role. And the manufacture of these will probably have to be done in many countries where it's not currently being done. They may be companies that ultimately are in the developed world or based in the developed world, but that need to open manufacturing sites and distribution sites in places where they are not currently. So that has to happen, and it has to happen sooner rather than later. It has to start happening in months as we turn the corner ourselves. It can't be years that's happening, or else we just give the virus a second shot, and that's not good. However, again, who are we is an interesting question, and I think we are kind of mistaken about who we are. We think of ourselves as youthful, vibrant, and healthy. We are none of those things. And I don't mean that as US bashing, but we are demographically an older nation. Our demographic pyramid skews towards the higher end of the distribution. That's at least been partially responsible for why, when we let the virus spread, it was so devastating. Because there's no doubt this virus takes a much higher toll on older people than on younger people. That's not, and I really don't want that to be read as young people are safe. But if you're really going to look at serious morbidity and mortality statistics, it's at the high end of the curve with this. It skews that way. And because we're older, things will take that toll. With older comes also comorbidities. We tend to have chronic illnesses and things as we get older. You start to get things like obesity goes up, diabetes goes up, heart failure goes up. All these things for which place you at a pretty high risk if you get COVID. And so we really need to be vaccinated. I don't know that if you were to say what nations should be pretty high up in the queue to get vaccinated, I would put us pretty high up in the queue, just on a who's vulnerable point of view. We've been taking a huge hit because of where we sit on that demographic pyramid. And by the way, it goes back to our talk in December of 2019, why immigration is good for us. Immigrants are young. Mm-hmm. And that makes a society more vibrant, more economically vibrant, more healthier, all of those things. And so we need to do something about that. And so I think we often look at immigrants as coming here to take something when they actually make us a better society. But that said, and we are also super spreaders. We travel a lot. And we refuse to stop traveling. And so vaccinating us makes some sense, vaccinating us early in the queue to prevent that. So I think that, and that comorbidity thing I talked about half of America has a comorbidity that puts them at risk for this, which is why those high priority groups, it's taking us so long to get through them, even though we're vaccinating almost 3 million people a day, because half the country falls into it, that part of the queue. So I don't think there's anything wrong with us prioritizing our population, but then we have to make a quick pivot, and we've got to start helping the rest of the world, because it will come back to haunt us if we don't. It's in our self-interest. It's just that's, again, when we really are all tied together in some way, what helps my neighbor helps me, and it's just that simple.
What you said makes me want to ask this question. What has been revealed to you as you look at this about the country and the world? I mean, as you started a minute ago saying, we think of ourselves as young, healthy, robust, but in reality, we're vulnerable with comorbidity. And that's something for society to consider. I mean, does this change that in the future? Does it cause change, lasting change for our society and the way the world functions?
I hope so. I hope that we have a serious reckoning with these issues. And to some extent, we're talking about generational justice here. One of the things that I have really noted is the degree to which a long-standing generational antagonism in the country has been exacerbated by the pandemic. A year ago, I started seeing on my social media feeds younger people referring to the virus as the boomer remover. And it's that resentment of younger generations towards the baby boomers who largely came through during fairly prosperous times in the country, were able to accumulate our share of goods and housing and education and all that. And a younger generation that's really came through with things like the financial crisis of 2007, 2008, and with their college debt being much more exaggerated among them, often still living now with the pandemic shutdown and the tanking economy, living at home with parents, unable to move out and buy their own home and start their own families. And we, we older people need to start looking at them and saying, why do they resent us so much? And what is actually fair here? Instead of people like myself saying, oh, I paid my student loans, they need to pay theirs.
Mm-hmm.
We need to say, look, they've had a different set of economic circumstances they came through. And if we really want a vibrant, healthy US economy, we've got to take some of that debt off their backs and let them marry and buy a home and start a family and revitalize the economy by doing all those things. And so there is a kind of intergenerational justice that comes from that. And in turn, we want those generations to also say, look, if there's another pandemic, we want to protect the older people. We're not eager to see them removed from this situation. And therefore they should be willing to sacrifice and limit their travel and things like that. That we've seen a lot of evidence they were not willing to do. They saw this as our problem and not theirs. And I really, if I could heal one divide in the country, that would be the one I'd pick. We focus a lot on the partisan politics, and that's a big, important problem. But there is not intergenerational solidarity, not nearly to the degree that that would make us a much healthier society.
I'd be really interested to talk more about that. We have a few minutes, but that's really interesting because it has such impact beyond healthcare and our response here, but where we're going as a nation.
Mm-hmm.
Mark, you're at Loyola University, Catholic Jesuit institution. There's a lot of conversations about vaccines. Where's the Pope and the Vatican and the Church on vaccines ethically?
Yeah, great question. And it's simple. Pope Francis has been urging everybody to get the vaccine when they have the opportunity to do that, just like he's been urging them to do all the things that we can to prevent the spread of the virus, that it's our duty to our neighbor. Pope Francis has been so strong on the problem of the globalization of indifference, that we just become indifferent to each other, and that he's really has pushed it was the theme of his first address outside of the Vatican, and he's pushed on that issue the whole time. And again, this indifference, that I not worrying about each other and how we affect each other with our behavior. And so the vaccines fall under that. Now, there has been some concern among some Catholics, particularly on the Johnson & Johnson vaccine, and it's an issue that has come up about that it's from a fetal cell line, that it's made from a cell line that was originally from fetal tissue decades ago, many decades ago. and the cell lines have been cultured and so on. Now, this is not an old issue. It's not a new issue in the church. It's an old issue. This has happened with some vaccines in the past, and the church has evolved a set of teaching on this that we are not cooperating with that original evil in taking the vaccine. If you believe in it, that the cell lines were cultured from a wrongdoing initially, it is that our cooperation with that is so remote, that's such a remote thing that happened, and we are not fostering that wrongdoing any further. We're doing a good by taking the vaccine. And so the Congregation for the Doctrine of the Faith and other church bodies have issued statements on this, that if you have the opportunity to take the Johnson & Johnson vaccine, it is a good thing to take it, not a bad thing. But again, for a lot of Catholics are hearing about this for the first time right now, because they didn't realize the issue wasn't so widespread when we're talking about other vaccines that are less common. And so they're not aware that there is a developed body of theological thinking that the church endorses that favors the use of the vaccines at this point. And so there's been a lot of trying to get that information out there in the Catholic media.
Thanks, Mark. So as a professor, what homework would you give moving forward? What is it that we should be doing as we still have COVID, as the realities of the world, as we've discussed, are, what is it that we should be doing as individuals in our communities?
Well, as individuals, I think we should be doing the kind of questions you've been kind of asking me, which is, what lessons do you want to take forward from this? And we should all be reflecting on that. It's very simple ones, right? This year there was no seasonal flu because we washed our hands and we, we tried to keep our distance from each other. And in the future, we should wash our hands a lot. That's a kindness to your neighbor. In our office at the Bioethics Institute at Loyola, we always told people, don't come in when you're sick, stay home. Don't get your neighbor sick. However, if you have a cold, nobody can stay home 7 to 10 days that it takes to get a cold, right? Nobody ever told me that, if you stay home 2 or 3 days, when you come in, wear a mask. We should do that. These are simple lessons. Take the kindnesses forward of how we can keep our neighbor healthy. Try to learn those lessons and tell the stories of the heroism. Tell the stories of those nurses and doctors that you know and what they did. Remember, I'm not going to get emotional here. Remember those we've lost. Listen to their stories. Don't shy away from them. And if you're a boomer like me, talk to young people. Listen to their ideas. I'm so tired of hearing us characterize the younger generations in negative ways. Hey, we weren't perfect when we were young. I hate to tell anybody my age. This generation, as I've gotten to know them as students, I think may be the greatest generation. We could focus on the kids who went to spring break and didn't think twice, but forgive them. Focus on the good. I think that we have a generation coming along that is more oriented towards others than perhaps any generation in our history. Nurture them, foster them, fight for policies that give them a real chance to make a good life for themselves, because they'll make a good life for the rest of us. I sometimes in my more poetic moments, which I don't have many of, I sometimes, as looking at the students I'm dealing with today, I feel like that gospel story of Simeon in the temple, where when Jesus is presented to him and he just thanks God for living to have seen that moment. I actually feel that way about the younger generations right now. And I urge everybody to work together to see that and to heal this generational divide. Because at our age, it isn't about getting more for us, as old people. It's about what we leave behind. It's about the future of this country and the future of this world. And let's do everything we can to support the people who are going to be carrying that forward. That could perhaps be our legacy.
Mark, thanks so much. Thanks for this last hour, for your words. At this time, because of COVID, we're doing this virtually, and people have joined us from all across the country. In lieu of a piece of artwork from our local Susie Kappa Arts Center, we'll make a donation to the Black Hills Work Susie Kappa Arts Center in your name.
Thank you. That's a wonderful tribute.
All those joining us online, please fill out the survey that should be in the comment box. A link should be in the chat box. Thanks for joining us today. Our next guest is Steve Long, CEO of Hancock Health in rural Indiana, and that will take place on April 22nd. Mark, thanks so much. Hope you have a great rest of the day. Really appreciate the conversation.
Thank you for having me, Matt.
Have a great day. Bye.
Bye-bye.